Hi, my name is Jerrod Hendry. I'm an emergency physician here at Peace Arch for about the past 16 years. The pandemic has been a huge change for us. Over the last couple of months, we've had to really learn what a pandemic is, what we're trying to fight, and trying to get control of the conditions that we're in. It's been a huge learning curve. There's been huge changes within the whole hospital. Our department has been significantly changed physically, as well as the stressors and stuff that have happened. Now, a lot of what we do is just being prepared, and that means right from when you get here is changing, getting into scrubs, getting into full gear, gowns, masks, goggles, everything in order to make sure you minimize your contact with patients, as well as just being prepared for anything that comes in the door. Once we get going, our department is now split into multiple different groups, and that's depending upon how likely we feel that the individual is going to be a possible COVID case. That changes my job a lot in terms of having to manage the risk to myself, the risk to the patient, and the risk to the staff that's around. So having to make sure that we're keeping contamination control to a bare minimum, but still trying to treat everybody correctly, make sure that we're not focusing too much on COVID, because unfortunately people still have the regular things of heart attacks and strokes and multiple different things. One of the things that's been an issue recently is that people unfortunately are so scared of coming to the emergency department that they've unfortunately neglected themselves because they're so worried. And that for us is difficult, because we don't want to see, we're doing everything that we can from our side, but we also don't want anyone to be so scared that they wouldn't take care of their chest pain or their abdominal pain, because we are doing a very good job of keeping everybody that we think is a possible COVID case or anyone that can contaminate away from the rest of the individuals in the department. So I would stress to everyone, please, if you've got chest pain, if you've got abdominal pain, you've got something that really needs to be looked at, don't hesitate to come in. We're here. That's what we're here for. One of the things that's come out of this has really been the support that we've gotten from the community, places that we didn't even kind of know about. The food from restaurants, this MPM Cheer. It's a huge morale booster for us in the Emerge, because we get so sort of caught up, especially at the beginning of this, with stressors, and having that little bit of, we would have the whole department sort of come to a standstill at 7 o'clock to come outside. And it was a real morale booster for us. We're going to get through this. This is unfortunately something that's happened. It's not been seen before, but it will end. It will come to a conclusion. It's just unfortunately going to take time. And with that, it requires patience. We just want everyone to stay safe, be smart with what you're doing, and you got to have a bit of patience. Unfortunately, it's going to take a little time, and we're not quite sure exactly how long, but please be smart with what you're doing. Keep in contact with those people around you, whether that be on video message or something, but keep physical distance, and let's just give it a little bit of time, and this will end. And hopefully we'll all be safe and healthy at the end.